Hello, Jen.
Aloha. I'm here today with a very special guest at a very divinely timed interview. I am happy to share with you Dr. Russell Kennedy, who lives in British Columbia. He is a very rare among physicians in that he specializes in the very disorder that he suffers from himself, which is anxiety. Dr. Kennedy has degrees in advanced training in medicine, neuroscience, and developmental psychology. He knows more about the understanding, treatment, and healing of anxiety from more perspectives than anyone else. It's not all science, though, as he is also a certified yoga and meditation teacher and was a professional stand-up comedian for over a decade while being a doctor during the day. He would stand as a comedian at night. And under a therapeutic dose of LSD, he discovered how he could heal himself from anxiety. And now he shares these insights with others who struggle with this chronic emotional pain. Dr. Kennedy's upcoming book, The Anxiety RX, will be released in June of 2020. And I couldn't be more grateful for our connection right now as we are in the midst of a planetary global healing crisis, or whatever you want to call it, where many people are probably listening in and experiencing at some level some awareness or some feeling or sensation of anxiety at this point in time. So I'm very honored to have you on the show today, Dr. Russ. Thank you so much for being with us.
Thanks, Jen. Yeah, the first thing I'd probably say is, we use the term anxiety, and really a better term to use would be alarm, because a
Mm,
lot of people don't understand what anxiety is. If you say, oh, I've got anxiety, probably half the people you talk to won't know what you're talking about. But if you say I'm feeling alarmed, everyone's felt alarmed. So you know what that feels like. And we're in a general place where we're feeling a lot of alarm these days. And then with alarm, our mind has to compulsively make sense of that alarm. So it usually makes a scary story to just the anxious thoughts of the mind, which have no power unless you believe them. But it's the alarm that we hold in our body. That's what's
mm.
really the engine of this. And we need to start looking at treating the alarm in our body as well as the thoughts in our mind. And I think that's what we're missing a lot in therapy today, is we're focusing so much on trying to fix the thoughts when the alarm is what we really need to focus on, the alarm in the body. So thanks for having
Mm.
me. This is great.
Yeah, I love that you shared that. One of the words that's been coming through for me lately as I've been coaching other people with this awareness of the word anxiety is I've been hearing activation. Like there's this sort of
Yeah.
this activated response in the body that is really sort of teaching us or showing us what it is that might need to be worked on. And so maybe that's going to come up in our time together today.
Yeah.
So I'm really excited to share. Most of my listeners know everything that I do, everything that's on the show is all about um, just sharing expansive, integrative practices through holistic healing, whatever that may be. And it's really nice to have a guest on the show that has the experience of, the science and the degree through you're a medical doctor, but then also having studied neuroscience. And then on the other side of the spectrum, yoga and meditation. And I know that your wife is a somatic breathwork practitioner. And so being able to share somebody with this bigger view, I think is just such a special gift. And I'm just really excited to have you on the show to share some ideas about where anxiety comes from and, why maybe the traditional practices or therapeutic ways that we're coping with anxiety may not be working. And I know this is going to be helpful for my community. I want to start by asking the very basic, where do you believe, where do you see, sense, and feel from your experience that anxiety comes from?
Well, I'll tell you my own story. My own story is that my father was schizophrenic and bipolar. So, and he really didn't start to get, really was about 12 years old. So I kind of grew up when I was like 8, 9, or 10, I love my dad. He did lots of stuff for me. He taught me how to do lots of things. And then I started to really see him go off. And I just, as a child, I had no idea what was going on, and just got more and more worried and afraid for him, because he was never violent or abusive or anything like that, but he would totally change. And for a child, when you see a parent completely change like that, it's very anxiety provoking. So for me, you know, early on, I saw my dad go through these things where he'd be, you know, so depressed he couldn't get out of bed, or so manic that he had all these ideas about, you know, how to open a pool hall, or just, you know, he'd get these fantastic ideas. And it was scary for me, you know. And then I studied medicine as I got older and realized there was a genetic component. And I was always worried about getting what he had. You know, that was the thing. I was always worried about getting what he had. So that really cued my anxiety. Plus, I started off as a sensitive child to start with, you know, so that was, and I think most of us with anxiety or alarm issues are sensitive, and that's how it kind of shows up. So I believe that what happens is that we get overwhelmed. Typically in childhood, we get overwhelmed with something. We don't have that secure attachment in our parents or our caregivers to really reassure us, so that we can metabolize that so it stays in our head, and we can process it and understand it. And when we get trauma that's too much for us to bear, I think it spills over the mind, because the mind can't, it just gets overwhelmed, because one, it can't handle it. You're typically a child. And two, you don't have the people around you to kind of be able to support you through it. So what happens is it overflows the mind, and it gets lodged in the body somewhere. And you talked about LSD, and that's what, when I did LSD under this therapeutic, I didn't do it for, you know, a Saturday night booze up. I did it under a therapeutic environment. And it really showed me that my anxiety, what I called my anxiety, was actually lodged in my body right below my heart. And that really changed my view of therapy and what anxiety really is, because I believe anxiety is more of an alarm that's held in the body than anxious thoughts of the mind. Anxious thoughts of the mind are the byproduct of this alarm that's held in the body. And we're spending all this time trying to fix the thoughts of the mind, when we're really trying to fix an effect rather than fix the
Mm.
underlying cause.
Yeah. And what I hear you saying that I love that you shared so gracefully is that anxiety actually has many layers. There is a genetic component, as you said. There is the mind, there is the body, there's the thoughts, there's our emotions about it, our perceptions, our beliefs. And also I'm curious about talking today a little bit about maybe the body chemistry that's happening too. I'm wondering if you can share a little bit about how anxiety shows up in the body, because what I realized recently, and I shared with you before the show, is I never actually really myself personally acknowledged that maybe I had anxiety. I was able to keep myself safe by staying in the doing and the, yeah, like I'm
Yeah.
realizing staying in the mind, right? So the mind, it plays this role. And what I notice is that what I perceive to be a healthy response to anxiety was the result of being an overachiever and a perfectionist, where in my mind I actually created the belief that if I could keep achiever, that I was, quote, in control. And what I noticed is that the fear of losing control, which is kind of an alarm, right? That's an alarm that there's a fear of losing control, was creating some habits. So can you share with me a little bit, like, what is actually happening in the body? You talk about it being a physical response, but I know that you studied neuroscience. I know that there's some firing of something that's happening. We hear the fight, flight, or fight response. What is actually happening in terms of physically and chemically in the body when we're feeling anxiety?
Well, first of all, I'd say we're feeling alarm. And then when we feel alarm, what happens is our sympathetic nervous system starts to overact, which is our fight or flight nervous system. And everybody believes that the happens in their sympathetic nervous system. But really what happens in our sympathetic nervous system first is pursuit. So if you think, this is the example that I use. So you're a child in a store and you've lost your parents. So you go into alarm because you've lost your parents. Now your first impulse fight or to run away, your first impulse is actually to find your parents. So the first impulse of fight of the sympathetic nervous system is actually pursuit, because what it wants to do is it wants to reconnect you with your attachment figures. So that's what the activation is all about. So the activation of your sympathetic nervous system is to trying to get you to connect. It's not trying to get you to fight or to flee, because we're not, this isn't 70,000 years ago, and we're not living in caves. Most of our issues now are mental. They're not physical. So what happens is we need to get back into this place where we feel ourselves and we connect with ourselves in our body. And this leads me to what you were saying earlier on about, overthinking and overachieving, because basically what happens, what I said earlier on, is you've probably got some trauma that's stored in your body. And I know I definitely do. I know I'm an overachiever as well. And the reason why that we think so much is because it prevents us from actually visiting that place in our body that's painful, right? So we overthink, and that's why we have to make the worries so huge, because if you were worried about, oh, I wonder if I'm going to run out of crackers today, that's not a big enough worry to keep you out of your body. So if you worry about, oh my God, what's going to happen to my kids, or what's going to happen, am I going to get this virus or whatever, that's a huge worry, and that'll keep you up in your head. But really the place that we all need to go to heal from in the first place is because when you were a child, it wasn't safe to be there. And my message is, you're an adult now, the place has changed. With support, you can go back and visit that old part of yourself that's still stuck in your body. And that's the engine of your anxiety or your alarm. And once you fix that source, then the thoughts just disappear, because the thoughts are just the effect. They're not the underlying cause. But we get caught in this chasing our tails thing, because the more we think, we temporarily stay away from that feeling that's really uncomfortable, but we can only do that for so long. It's like we're running and running and running and running and running. And this as well as I do, is after a while, your mind just exhausts itself. And when you're talking about physiology, when you crank up cortisol, which is the body's sort of anti-inflammatory hormone or anti-stress hormone, and then epinephrine, adrenaline is the other name for epinephrine, you fire that up in your system, you have all this nervous energy, and it's not 70,000 years ago. We're not being chased by a predator. We're not fighting. So we don't have any way of discharging those chemicals. That's why people say exercise is so great for anxiety, because we build up all these, catecholamines or adrenaline or epinephrine, and there's nowhere for it to go. So of course it sits there for 2 or 3 hours until it finally dissipates, and you're edgy and cranky and you don't know what's going on, and your brain goes into survival mode. And when your brain goes into survival mode, all you look for is threat. And that's the way we're designed from an evolutionary perspective. When we go into survival mode, we just look for threat. And if there's no threat in our immediate environment, our mind goes, hey, we might not make our rent this month. Hey, you've got that huge exam. Hey, you've got to go talk in front of, 500 people on Thursday. Your mind will always be able to pick up something that makes you afraid. And then you attribute that as the cause, but that isn't the cause. The cause is this unresolved alarm that's sitting in your body that you're afraid to go back and visit. And I don't blame you, because I had the exact same thing. And that's coming back to, that's what LSD showed me. It's like, hey, you're chasing your tail. You're going after the wrong thing. It's it's getting a hold of that part of you that was maybe, 6, 8, 10 years old. Your parents divorced. Your grandmother died, like some major thing happened to you. You weren't able to metabolize it, and it's still in your body causing problems. And the more of that stuff that you have, the more, abuse, abandonment, loss, rejection, anything like that in your background creates more alarm. And the more alarm that you have, the more likely you're going to get trapped in your thoughts, because you don't want to have to go back into that old feeling. Like if you loved your grandmother with all your heart and she died suddenly, and you haven't metabolized that trauma, you're going to try and do your best to stay away from that. And one of the ways we do that is to stay in our heads, to overachieve. And, and at some point we're going to have to go back and revisit that. Now, hopefully, Cynthia, my wife's a somatic experiencing practitioner. So this is the work of Dr. Peter Levine, where he gets people back into the body. And I try and do this too. I try and say, where do you feel, your anxiety in your body? Because we get so wrapped up in believing that it's in our heads. But if you really look at it, usually it's somewhere between your chin and your pubic bone. It's almost always in the midline somewhere. And just think of it like having a broken heart, getting dumped or, getting divorced or whatever. Where do you feel that in your body? And that's what I really, with all the people that I work with, I get them to say, where is this alarm in your body? Because when you can find it, and then you can start connecting with it, because as kind of woo as this sounds, I believe that alarm is your younger self, is the part of you that watched your parents divorce, is the part of you that watched your mother have an affair that broke up your marriage. It's the part of you that lost your dad at a young age. That's the part of you that you have to go in there and fix, because that's the part that it's starting all this anxiety. It's not the thoughts. You can fix the thoughts all you want, but unless you fix that underlying issue, it's not going to go away. So that was a very long answer to what was probably a very...
Yeah, so I just kind of want to thank you for all of that. I'm so in alignment with all of that. That is where the name of the podcast, The Embodied Healing Self, came from in my own experience, and through reading the book Waking the Tiger from Dr. Peter Levine, having had my own near-death experience, and then actually doing the work to go back, because I was under medication for 5 days. I couldn't actually consciously remember the experience, but being able to go back into my body and almost relive the experience was actually what broke me free of the feeling of not being safe in my body. So I've had my own experience where I've been willing to go into the body. And so just for the listeners, to simplify, what I heard you say is that most of the issues that we are dealing with are mental, because we create a belief or a thought or a perception about our experience that we stay in our head, and they're not physical. Yet the healing is in the physical. It's in the body, the place where we can go to be curious about the alarm that's coming up, that's going to kind of maybe show us, because I know what happened with me is when I went into the body, then it triggered a memory that I didn't even consciously knew. I didn't have any conscious recollection of this memory. But when I went into the body, I went deep into the body, when I was noticing every sensation I could about the physical pain that I was feeling in the body, as if I was just there like I was 15 years ago, then I started to get memories, right? And so I hear you saying that we go into the body to begin the healing. And I also hear you saying, but we don't do this because it's painful and because it's uncomfortable.
Yeah.
And
A lot of the clients that my wife will see, because Cynthia is really, really intuitive. So she will see someone on the first visit, and they're usually 90-minute visits. And she can see, like me, she can see your trauma is. She can see where, your father beat you as a child. She can see all this stuff. And then she sort of slowly integrates that into someone's consciousness. And a lot of them won't want to come back because it's just too painful. But that's the only way you're actually going to get, some mental sanity over the rest of your life, is to deal with this as early in your life as you possibly can. Because then you have a tool, then you become a self-healer. You know where that pain is, and you know how to give it attention. Now, I did want to say something. It's not that I'm anti-talk therapy. I am definitely not. I think we need to do what Dr. Dan Siegel, the interpersonal neurobiologist, talks about, is have a coherent narrative of our lives. And I'll give you a quick example of that. If you would have asked me 5 years ago, what was your dad like? I would say, well, he was crazy. Like, he was crazy. He would pretend he was like the president of the United States, and he made all these crazy plans, and he really worried me all the time. Now, if you asked me 2 days ago, what was your dad like? I'd say, well, my dad had a really bad case of schizophrenia and bipolar, and it wasn't really him. It was his disease that I kind of, that I was afraid of. Because I know he loved me. He showed me how to do all these different things. And I know he really, really cared for me. Now that alters the way I hold that energy in my body. 5 years ago, I had a lot of resentment. I had a lot of fear. And now it's just like, no, it was his illness that hurt him. It wasn't, and hurt me. It wasn't him himself. So I think we do need talk therapy, but what I do see that what we're doing in this society now is we're focusing only on talk therapy. We're
Mm-hmm.
not really focusing on the body. We're not, and that's where, Cynthia really shines, is that she gets people into that place, and the people that are willing to go there are the ones that do the best. The people that aren't
Mm-hmm.
willing to go there, or aren't ready, at least at this point, and she tries to sort of ease them into it. But there's really, when you see where someone's triggers are, and you see them really, and both Cynthia and I do this, we can see this, we can take people farther in probably 90 minutes than 5 years of therapy.
Mm-hmm.
I can see where your traumas are. I see where they are. I mean, you and I were talking before this thing, and I said, okay, well, this is probably this, and this is probably that. And I can show you where it is. And it saves people so much time just knowing
Yeah.
where the root cause is. It's like, this is where the treasure is, and this is what you
Yeah.
have to do to find it. But a lot of people aren't willing to do it, because our habit has been to avoid, distract for so long, that going back in there is just too scary. And for some people, some traumas are really, really horrible. And I don't blame people, and that's where sort of the role of medication and that kind of stuff comes in, because there are
Mm-hmm.
some traumas that I do believe that are just too much for people to go back into. So I'm not
Yeah.
of the belief that, I can fix everybody or whatever. It really is. Children are so sensitive,
Mm.
and it doesn't take much to really, wreck a child's life. It really doesn't.
Mm.
And one of
Mm.
the quotes
Yeah.
that I love, one of the and I'll give you a chance here. I know I'm talking a lot. One of the quotes that I love is, if you abuse or abandon a child, they don't stop loving the parent, they stop loving themselves.
Mm.
Right.
Wow.
And once you stop loving yourself and you create that split, then from that point on, the child isn't integrated anymore. And and every little trauma that they have gets deposited into this alarm bank, this account of alarm that they carry with them for the rest of their lives. And unless we go back in and start making withdrawals out of that old alarm account, people just don't get better.
Yeah. Yeah, and I'm a huge fan of the work that your wife does, the somatic. I myself use an intuitive process through somatic inquiry myself, and I find it to be very clear, very efficient, and it does wonders. And I love that both you and your wife are doing that work together. It sounds pretty powerful. As you were speaking, there was something that came through for me around the energy body. And so you and I both being intuitives, your wife, like we all have this sense of like energy bodies and the energy that we're living in. And something that really came through for me, and just kind of looking at my own life, and then just being the parent of energetically sensitive children as well. Would you say that, do you see or do you notice a correlation between empaths and an elevated level of anxiety?
Oh yeah. Oh yeah. And here's my little theory on that. Jen, you'll notice I have theories on everything.
Yeah.
Here, I think on some level, empaths come from trauma. I think
Yes.
what happens is we're sensitive, so we can read people very well. And, you go for what you know, basically. So for me, I was really good at reading my parent. That's what made me such a good doctor, is I could read my patients really, really well. The problem is, it's kind of like a balance, kind of like a teeter-totter. The better you are at reading other people, typically, the worse you were at reading yourself when you were younger,
Exactly.
right?
Yes.
So what happens is that we hone this skill of being very good at reading other people, but not so great about doing it ourselves. And I see this a lot with my anxiety people, and myself to some extent too, is that we lose touch with our bodies to the point where a couple of years ago, I would wait for hours until I ate, because I didn't really feel the
Mm.
sensation of being hungry until I was starving. And the same thing with going to the bathroom. Like, it'd be like, I wouldn't feel like I had to go pee until I really had to go pee. So it was one of those, and it's one of these like aha moments, right? Because we do all this time we spend in our mind and our thinking, pushing down the body, we lose that sensation in the body after
Mm.
a while, because we haven't practiced it. And then, and you'd be kids who
Mm.
have a sensitive background are bedwetters, because they
Yeah.
lose the sense that they need to pee, right? And that happens to all of us. So the more we go into our heads, the more we lose our body. And typically what goes along with that too, and I don't know about you, but but self-care hasn't been my strong suit through my life. You know, like if I'm going to go make myself a sandwich, I'll, you know, put a couple of pieces of bread together. I might throw some ham in there, and then some mustard, and that's it. Whereas I watch my stepson, Alex, make a sandwich, and he's got pieces of bread, he's got lettuce, he's got tomatoes. Maybe he's got 2 or 3 different types of tomatoes. He might put some salad dressing on there or some oil. It's like, you know, you really see, I mean, I really see how poorly I looked after myself for so long. And then, so looking, my whole point is that we become empaths because we're sensitive and we're good at it. And we know how to read people and we know how to give them what they need. Specifically, a lot of times it's because we had to read our parents to survive. So if our parents weren't doing well, we weren't doing well. So if we got an early warning system of my dad isn't doing really well, what can I do to sort of do this? So everything went outwards, and then you get rewarded for it. Oh, Rusty, he's so good at, you know, helping around the house, and he's so good at knowing this and knowing that. So we get rewarded for it. So we start, you know, whatever you're good at it, you get more of. So I just kept, you know, focusing on other people, which is why I became a medical doctor and all this kind of thing. But I lost touch with myself. And I think that's true with a lot of empaths. We're very good at reading other people, but not so great at reading ourselves. And since I've spent a lot more time reading myself, my empathic nature has gone up like 100%, you know, because now I have that combination. Now I have that real combination of, okay, I can read other people really well, and now I can read myself well. So now I know what's going on. So when I feel something in me, it's probably going on with the person that I'm working with as well. And it's not so much my issue anymore that I've pushed away and I'm not that sensitive to. Now I really feel it. Now I really see it in other people. So I think that's where empaths come from. I think we're sensitive people to start with. And I think we also a lot of us had to read our parents, because if your parents aren't okay, you're not okay. So you had to make sure that they were okay. And that becomes kind of this compulsive need to look after other people and leave and put yourself second. And that can only happen for so many years before things start to crack.
Yeah, you know what I learned in my own journey. So when I shared with you that experience that I had where I was willing to go deep into my own sort of memory of the trauma that I had with my near-death experience, the end result of the willingness to go there, because I had a fear of dying again, right? Of course, because I didn't feel safe in my body. But when I did, and I went there again, what happened is that my clairvoyance and clairsentience and clairaudience started to come back, because I no longer had that kind of like that distortion of fear, right? It was in pure surrender. But what I learned along the way that was so interesting for me in my own personal journey is that it was easier for me to be in someone else's pain than my own.
Yeah.
And so being an empath then it was an escape. And I was like, oh my gosh, like my gift is now my shadow.
Yeah.
It is way easier for me to be in your pain and take your pain away than for me to dive to the depths of what's really happening for me. And so what I want to say about that in being a child with a parent, I think what we realize is there's a need that wasn't met. Either it was the need for safety, the need for love, the need for recognition, not just because we did things well, but for who we were, not just what we did, right? That I think every single listener on here can relate to. We've all experienced trauma. We all have a need that wasn't met.
Yeah.
And it resonates, and it's like stuck in our body somewhere.
Yeah. And the more sensitive you are, the more love you need, right? And the more sensitive you are to the absence of that. So, you know, my brother and I are very different. My brother's very stoic. He's very kind of doesn't like to talk about feelings or any of that kind of stuff. And I'm the opposite. I'm like, you know, I don't like superficial conversations or whatever. So, but it's funny just to see the different personalities, you know. So I needed, in a way, I needed more love than he did when we were growing up, right? He was able to kind of just like, okay, you know, if you give me 30%, I can handle that. If you give me 30%, it's like, I need 80. Like you got to give me. So then we get into this coping strategy of one of the coping strategies is anxiety, is worry. because worry serves a purpose. People say worry is useless. Worry actually does serve a purpose in that when we are younger, it keeps us away from that feeling in our body that was just unbearable, because that's why it got repressed into our body in the first place. It was just way too much for us to handle. So we learn to overthink to escape that excruciating pain in our body. And, some people do that for the rest of their lives. But it's really important to realize what you're doing is you're actually avoiding the very thing that you need to go into. And that's why, that's why I love Cynthia's work, is because you need that other person, you need that other regulated nervous system that you didn't get when you were younger to be able to go through those traumas. I with Cynthia, I go through, and Cyn does touch work too. She's training in touch work as well as the sort of somatic experiencing stuff. But just as a child, feeling that touch now, like our amygdala, the part of our brain that really focuses on fear and intense emotion, can get activated by touch now. And that can go back to the time you were traumatized when you're like 12 or 13. So we're starting to see now how important touch work is to help people. Now, if you look at the medical profession, psychiatry can't touch people. They'll get sued, So it's one of those things, like we're seeing now the most important things that help people really heal from mental things are somatic experiencing, for one, somatic therapies, Hakomi is another one, and psychedelics. LSD, ayahuasca, ketamine is being used now as a psychedelic used for assisted in psychotherapy. So it's getting beyond that wall of the ego that feels like I can't go back into that place again. I just can't go there anymore. So when you have a regulated nervous system in the room with you that says, okay, let's go there together, and I'll give you what you didn't get back then, because the amygdala has no sense of time. That's the thing about the amygdala. It has no sense of time. So whatever trauma, my dad killed himself, 31 years ago? And there's part of me that still thinks that I'm going to come around a corner and I'm going to see him or whatever. So the amygdala, it never forgets, for one, and it has no sense of time either. So if you've had a trauma in your past and your amygdala brings it back up, it doesn't feel like it's coming from the past. It feels like it's still happening.
Yeah.
So
I had that experience. I mean, literally to the point of vomiting and having excruciating pain in my liver from when I had liver failure. It was crazy. I really thought I was there again. And it took my willingness to go there to actually be willing to consider the fact that I could die again, because that's what the brain does. It's like, well, it's going to happen again. But like when I had that experience and I went there, and I remember, though, I froze. Like I did freeze in the revisit of that experience, but it was the most healing experience I ever had, because I was willing to fully go the length of just full surrender and being willing to do it again. And it just let down every guard that was actually keeping me from my gifts, which this was like a couple of years ago. Right.
Absolutely.
And I'm sensing that that's probably happening a lot in the world. Our beliefs and our thoughts and our fears, they're creating blocks that are actually keeping us from, we're not just talking about gifts of intuition and empathy, but connection and love too.
Well, that's the thing too. Like if you grow up in an environment where love wasn't safe, which is basically what I grew up with, is that I loved my dad so much, but then I saw when he would go crazy that it wasn't safe. So your ego, it's kind of like putting your hand on a hot stove. Like when you'll only do that once when you're a child, right? So yeah, avoiding putting your hand on a hot stove is great because it hurt, but avoiding love because it hurts is going to suck the life out of your life. And that's, I think a lot of us as children, we get into this thing where love isn't safe, or it's complicated, or it isn't, we don't get our needs met. So if that's the case and we don't trust love, the only thing that's going to fill that up is fear. The only thing that's going to fill that space is fear. And it's like you said, it's going right back into that. And sometimes it takes an illness where our defenses are so low that we can't protect ourselves against that, going into that feeling anymore. And that's basically what happened with me on ayahuasca, was that, I spent a lot of my life in my head. And the thing about ayahuasca or any of the psychedelics, And again, I took them as a therapeutic. I wasn't like hey, let's get high kind of thing. But it basically, because I spent most of my life in my mind, as soon as I took this ayahuasca, it takes your mind away from you. So it was one of the most, well, it was the most terrifying experience of my life,
Hmm.
because I was so used to being able to kind of manage things, spin plates with my mind. And then this drug took my mind away from me. So now I had no choice but to go back and face those feelings. So in a
Hmm.
way, for me, it was kind of like a near-death experience as well.
Hmm. Yeah, absolutely. The willingness to lose control of your mind. And um, yeah, I hear that. And it's so vulnerable. Like I hear the message of like another thing that came through is just the vulnerability and the willingness that it takes to really do the healing work, right? The path isn't around it or over it, but through it.
Yeah.
And the willingness to even not only just surrender or, lose your mind through plant medicine, but the willingness to receive love, even the vulnerability in that, because so many people created the survivor strategy of living in their mind because they didn't get what they need. They didn't get the safety. They didn't get the love. They didn't get the whatever it was as a child.
Yeah.
So like we started this conversation with all of that. So
Yeah.
it really is such such an amazing and rare gift to have a person who can talk about the physical body from the perspective of being a medical doctor, who can talk about your own anxiety and your own experience, but can also talk to the energy body through intuition, through somatic practice, and the whole picture. I don't know anybody else who's been able to do that. And I think it makes you such a wonderful and rare gift for the listeners. And I know many people that suffer from anxiety. So I'm hoping that the listeners will get your book, check out your website, and check out the work that you do. I want to dive a little bit deeper into the role of the immune system, just because because I know that you can answer these questions. In my own personal life, again, this is a survivor strategy pattern that I created out of anxiety, was to keep the body safe, was to overlearn. And I was a mechanical engineer. So after the near-death experience, I became a health coach, and then I studied functional medicine, and I studied detoxification and herbal wellness, everything I could do to keep the body healthy physically, and it worked.
Yeah.
So there's still a part of me that believes that there's a lot of value in the role of the immune system, because what I noticed in my own life, in myself and in my daughter, is that when my immune system was strong, I wasn't so easily triggered. And I'm wondering if you can sort of help me bridge the gap in that. Just before we started talking, I shared with you a little bit about, I have a middle school daughter who months ago was experiencing a lot of anxiety. And some of it was from being in middle school and being bullied. So it was
Yeah.
definitely environmental. But there was also a part that was kind of showing up through testing that we did. We did some stool testing and some gut testing. And I had shared with you that 10 years ago, she had been diagnosed with PANDAS. And she had she had been labeled with Crohn's disease and so many different things. She was on 6 prescription drugs at the age of 3, which is what led me down a holistic path, because the sickest she was when she was on all those medications. So we then began to heal everything through food and herbal wellness and energy work, the whole thing. But I don't know if it's just the chemistry in the body changing because of being an adolescent and the introduction of estrogen, or if it's the altering of the chemistry in the body because of the extra stress from being bullied. But there was something happening that was triggering. So, I know you've talked about this, the motor tics, the obsessive
Yeah.
behavior, the the extreme. But I think the obsessive behavior shows up a lot too with the anxiety. What are your thoughts on like the role that the immune system also plays in helping to reduce anxiety? And you talked about self-care. Like, how important do you see the self-care part, the nutrition part, taking the right supplements in? Do you have any tips on that?
I think a lot of it comes down to your own, what we were talking about earlier on is about self-care. If you believe something helps you, then it probably does. So I created a hypno meditation on my website for boosting your immune system. So boosting your B cells, your T cells, washing your hands, doing all these things where automatically you do it. Automatically we reach for our face. Automatically we don't wash our hands as much. So I put people into this hypnotic state, and then I give your immune system direct suggestions to boost, to be functional, to feel vigorous, to feel grateful for this immune system that you have that really helps you. And it's free. It's basically on my website. If you go to theanxietymd.com or just Google the Anxiety MD, you'll find me. So the immune system is basically just kind of a marker for how you're doing in general. So if we look at the immune system, basically from a functional point of view, it's, is this me or is this not me? So if it's not me, it's going to attack. If it is you, it's not going to. Now, if that gets blurred, like if you, my instinct, not to get too woo on you, but my instinct is that
You can do woo. You
what?
can
Okay.
do woo.
Okay.
It's okay.
Okay. My instinct with Miley is that she's got some intergenerational trauma. She's carrying some stuff from your ancestors, from her
Yes.
ancestors. Maybe more on your father's side than on her father's side than yours. And that's what's manifesting now. So all this care and attention that she's getting is something that her ancestors didn't get. So we don't get too deep into that. It's something we can do offline, but that's the impression that I get. I don't think that it's from this current life. I think that she is sensitive. I think that what's happening in her school is the people who are sensitive, probably girls who are very sensitive, see her sensitivity. They don't like seeing that in themselves, so they lash out at her for it. Okay, so this is my intuitive stuff, and it's not organized. It comes from everywhere. So I think it's just reassuring her that she's safe and she's cared for, which I know that you do. But one of these things about these supplements, I think, is it shows her when you go this route and you say, look, I'm trying to help you. This is your way of showing her that you love her, right?
Yeah.
And you're
It's empowering her is what it is. Yeah.
But you're using your intelligence, to do that. So you're going for what you know. Like you're very intelligent. So it's like, okay, how am I going to use my intelligence to help my daughter? So this is what you're doing. And I guess on top of that, it's really important that you get, you use the social engagement system with her, so that you every day, you look into her eyes. Do you know the social engagement system? It's a neuroscience kind of term. It's also
I don't.
called.
Would you be willing to share?
Yes, absolutely. I'll give you the short version of it. The social engagement system is something that human beings use, typically using the vagus nerve, but all 5 of the cranial nerves as well. But it involves tone of voice, prosody of voice, facial expression, eye contact, and body language. So basically, we have this internal system in our it's in our evolution that, when we laugh, when we connect with each other, when we make eye contact, when we smile at each other, that A, boosts our immune system for one, and B, it boosts our sense of well-being and connection, because that's our personal connection that we are getting from each other. And that allows us to self-soothe. It goes through the prefrontal cortex, and I'm not going to go through the pathways, but basically this social engagement system that we have that uses eye contact, facial muscle. The face is the only place in the human body where the muscles are actually attached to the skin. And that's so we can show each other affection, or we can show each other how we're feeling. And what's happening, and here's a little sort of sidetrack I'm going to go on for a second, but why kids now have so much anxiety is that they are on their screens all the time, right? And you don't get that same level of social connection from a screen that you would from playing with your friends and being with your friends and seeing their trials and tribulations and seeing when they're happy and seeing when they're sad. And that boosts our social engagement system, that matures that social engagement system, so that we can use it to both soothe ourselves and soothe others. So when we use that social engagement system, and I get people even, in these days of quarantine, of using it on yourself, go to the mirror and just smile at yourself. As corny as it is, and as Stuart Smalley, I love you, Pete, gall darn it, people like me, it works. You are actually using a system that's been put into every single human being for thousands of years that will help soothe you. So if you just make eye contact, and you don't even have to say anything, like a lot of people say, go to the mirror and say, I love you. And if you have a problem with love, like I did for a long time, it just feels so disingenuous to go to the mirror and go, I love you. You're great. And if I don't feel it, it's just not going to. But the thing is, if you go to the mirror and you just make this connection that you're going to focus on feeling without thinking. Thinking is great and it has its place, but my God, the amount of trouble the human beings get into by overthinking is just, it's not worth it. You really need to feel. So just looking at yourself with a kind sense of, okay, how can I feel kindness to myself? How can I eat? And even that's a thought, of course. But basically what you're trying to do is engage that social engagement system, the body language, tone of voice. You can talk to yourself, you can, one of the things that I do get people to say is, what you like about yourself. I love my sense of humor. I love the fact that, I love my sense of humor, and that I did stand up for 15 years, and I still do it every once in a while. But, that's a part of me that I really like. So I go to the mirror and I say, that's a part of you that I really, really love, is that part of you that can kind of just entertain people, and just making that connection with yourself will automatically start to connect with that younger part of yourself, and it sort of pulls you together. And it's not so much getting into this whole thinking thing. So getting back to what you say about your daughter and the immune system, it all works together. Like that social engagement system is one of the things that everybody can use. And I use it all the time on my stepsons and my daughter, and I've got 2 grandkids now, but they're too young to, well, they're not actually too young to use it. If you look at how you look at babies, everybody looks at babies and they smile and they're like, oh, you're such a cute baby. And it just, that's our humanity. That's our social engagement system at work. And again, the reason why I think we're losing so many of our kids to anxiety these days is that they're caught up in their screens. And then when they get stressed, they go back to their screens for comfort. And there's no comfort there, really. There's distraction, which is basically this thoughts all over again. So it's getting back full circle to about Miley is, I think it's really showing her that you care about her and giving her these supplements, telling her they're going to work. A lot of times, just, when you have a loving figure telling you something is going to work, it works. So as far as the connection between the immune system and the psychological system, they're one and the same. It's like we can't split the mind and the body. Right. We try to, but we can't really do it. But it is one of those things where I think it's just this holistic kind of general approach to yourself and to the people that you love, and showing them that you love in a language that we'll understand, like a neurological language, a nervous system language, which is basically that social engagement system. And if we can engage that social engagement system, we're going to be a lot better off and have a lot better immune systems and just feel more comfortable in the world. Because one of the things I always ask, and I do this with just about every interview that I have, is I say, when you wake up in the middle of the night and you're freaked out and terrified, you can just ask yourself one question: am I safe in this moment? Am I safe in this moment that I'm in? Am I safe? And you are safe in this moment. Like if everybody looks around right now in the room that you're in, watching this on your computer or your phone, look around, take a breath. Are you safe in this moment? As much as the world's going crazy outside or whatever, or CNN's going nuts, or Trump's doing his thing or whatever, but are you safe in this moment? Like right now, are you safe? And do that 8-10 times a day.
I think that's the power in the somatic experiencing, is it brings you to the present moment. And that's really where the truth is, right? It's just the present moment.
Because worries are all about the future. That's the thing. Worries are always about the future. You can't worry about something that's happening now. Even if you're worried about you're not really worried about the COVID thing. You're worried about yourself getting it or your family getting it. And that's again in the future. All worries are about the future. And the thing about sensation is it brings you into the moment and it pulls you back, because there's no grounding in the future. There's no grounding in that thought-based world of, oh my God, oh my God. I call it the 3 W's of worry, which is what ifs, warnings, and worst case scenarios. So the 3 W's of worry. And basically what that does is it distracts us from the feeling that we have when we're afraid. So when you're afraid, when you feel this fear of COVID or whatever it is you're afraid of, put your hand on your chest, see if you can find that alarm in your body. And a lot of people can, if they just look for it. Put your hand on your chest and say, you know what? You don't have to say anything, but the version is, I've got you. We're okay. Because it's not the adult self that's really that scared about it. It's your child self that's worried about it.
Mm.
So you have to really reassure that child self. And that's what's going to cause you to sort of relax and calm down. And then if you have to go to the mirror and use your social engagement system, if you have to go to your partner or your spouse and say, hey, I heard this doctor saying that we have the social engagement system. Can we just make eye contact for 30 seconds? Even though it may be uncomfortable, can we just be friendly towards each other? Can we be more affectionate towards each other? That kind of thing will boost that social engagement system, and that will boost your immune system more than, I believe, any supplements or whatever, even though supplements don't
Mm.
hurt. But it's really focusing on that social engagement system, or the other name for it is human resonance circuitry. And
Mm.
really does make a huge difference, and we're not using it enough, and we've been losing it. We've been losing using that personal. The more we get into computers, the more we get into screens, the
Mm.
less we actually interact with each other, and the more that social engagement system starts to atrophy, and the more we're sitting ducks for alarm, anxiety, fear, worry, all that kind of thing, because we're not connected to each other.
Mhm.
And I think that's the biggest lesson in what we're going through now, is it's going to show us this is what happens when you stop being connected to each other. Anyway, that was a very long rant.
Yeah, I wrote down connection. Actually, I was of all the things that you've shared today, and I know that your mission is really to change the therapeutic model of anxiety from a mind-based approach to down into the body. So some of the things, just to recap, that we talked about today is, number one, the idea that we all need to come back to the body, and
Yeah.
that our thoughts about an experience, the anxiety itself, is an alarm about probably a previous experience, and then just to come in the body and to really acknowledge like how it's feeling. And maybe at that point in time you'll be, you might remember the experience, but the important part is to come back to the body energetically. We didn't come full circle to say this, but I think that we brought awareness to realizing just the importance of kind of our why, like why, kind of just being aware of energy that we might be taking on, and maybe creating healthy boundaries. And then maybe even a layer underneath, just kind of noticing like, what is the need to be empathic subconsciously, and just kind of bringing some awareness to that. So we talked about the body, we talked about the energy body. Um, and I'm hearing you say now that connection and presence is also an important part of working through some of the alarms that we might feel. As we wrap up our time together, since we are experiencing right now a time in history that our grandchildren are going to be reading about with
Yeah.
whatever's happening with this virus, there are people listening who want some guidelines, just some simple steps that they can do. So we know that connection is important. We know that it's important to get support if you need it. But for most people right now, what would you say, just a couple of takeaways through this experience that would be super helpful for them? And maybe it's repeating some of the things I said, but if you're talking to a group of people right now
Yeah.
who are just really looking for a couple of simple practices that they feel like they can actually do and embody, what would you say to them?
Well, first one is, am I safe in this moment? It's probably been, my daughter has a bit of anxiety, not nearly the same extent that I had, because I basically stewarded her through her own anxiety for her whole life, and she's way better now. But am I safe in this moment? And just really taking the time to feel that, not just saying the words, okay, I'm safe. Am I safe in this moment? Yes, I'm safe. Yes, I'm safe. No, it's like really feeling, or really looking
Mm.
around, putting your hand on your chest, rubbing your fingers together. I said on one of the other podcasts, touching your face. It's like, but I guess that's, now in the days of COVID, we're not allowed to touch our face anymore. But the reason I say touch your face is because the most brain real estate that we have to sensation is our hands and our face, right? So as soon as you put both of those things together, your hand and your face, you bring yourself into sensation. Your somatosensory cortex, the part of you that feels in your brain, is pretty much overwhelmed by your hands and your face. So if you use both of them at the same time, you're really going to bring yourself back into the moment. So the other thing I was going to say is that it's going to be uncomfortable in your body. Like when you
Yeah.
get afraid of this COVID thing or whatever, you're going to feel fear, and try and isolate where that feel is, and don't try and push the fear away. it's really important to just kind of, there's a practice called Tonglen. Are you familiar with Tonglen? It's a Pema
Mm-mm.
Chodron. She's a Buddhist nun. And she has this thing, when you feel the pain, breathe the pain in, because it does actually acknowledge the pain. When you try and push it away or think everything's going to be okay, whatever, your brain knows it's like, no, there's too much crap going on. This is just a platitude. But basically, if you breathe in the pain, like if you feel the pain and you just go, okay, I'm just going to breathe in this pain, and then transmute that as much as you can to love and healing, and then breathe out that love and healing to every other human being who's feeling exactly the same anxiety. But with this current crisis that we're in, I think it's really important to do that with everybody who's afraid of this whole virus thing now. So breathe it in, breathe in the pain, like really find that pain in your body and just breathe right into it and acknowledge it and feel it and really sort of even get into the minutia of that pain, because usually it's an interpretation of some kind that's not quite accurate. But what you're doing is you're getting really into the source of where you feel fear and acknowledging it and saying, I feel fear. It's not that we're going to push it away. It's actually allowing yourself to feel it. And when you allow yourself to feel it, there is this sort of relief that comes, but it doesn't come right away. Initially that fear is uncomfortable, and just
Mm-hmm.
acknowledging, yeah, this hurts, and taking deep breaths and all that kind of stuff is great. But the goal is not to get rid of the pain. And Bessel van der Kolk wrote this book called The Body Keeps the Score. And he's a psychiatrist from Boston, expert in anxiety as well. And he's like, it's not so much getting the pain to go away. It's developing a tolerance to the pain. It's developing like, this isn't going to kill me, because usually we go into it and it's so painful that we run out of it right away and we never really get to know it. Because in getting to know it, you're getting really to know your younger self typically. And when you get to know it, you realize, hey, this is just actually me. I've been running from for so long. I haven't been connected to myself. So pain, acknowledging that pain, feeling that pain, almost embracing it, almost like, I love this pain. I love feeling this. And then breathing, and then transmuting it to love, and then breathing out the love to everybody else who's suffering from the same kind of thing. It does actually start to make sense of the pain a little more, rather than just trying to put a Band-Aid over it.
Yeah.
And that's what I'd say. So, am I safe in this moment? I think is a massive thing. Like in the middle of the night, I use it every time I wake up in the middle of the night in a panic, which isn't unusual, even though I'm an anxiety doctor and specialist. It's like, are you safe in this moment, regardless of, and can you feel the pain and actually be okay with it? Just learn how to be okay with it. It's not going to kill you. And believe me, I've been in places where it's been horribly, horribly painful. And but the thing about that is, as soon as you start adding thoughts to that pain, you make it worse. And I'll wind up with this, is that you can handle the pain. The pain's uncomfortable. The pain hurts. It's very uncomfortable. But what causes it to go out of control is when you start adding thoughts to it. Oh, I wonder if my daughter gets this. Oh, I wonder what my mother's going to survive this. I wonder how this is going to affect, my livelihood. I wonder if I'm going to lose all my money. All those thoughts never allow you to get back comfortable with that pain, because you're just distracting yourself. If you get to a T intersection and you turn right into thought every time, and the path to healing is left, but you never go left, you're never going to heal. So it's really, am I safe in this moment? Feeling the pain, acknowledging the pain, not trying to run away from it. In fact, trying to relish it and breathe into it and allow it and accept it as best you can. Because typically that pain is your younger self asking for attention. We didn't get into that, but that's a 2-hour conversation. And then acknowledging that younger self, acknowledging the pain of that younger self, and just sitting with it and just letting it metabolize, as opposed to just running away into thoughts. So hopefully that made sense. There was a bit of channeling going on with me, so I don't know what I said or whatever. So
Makes perfect sense. And
okay,
it
good.
takes courage and compassion. So what I'm really hearing is, the course of the healing path is one of courage and compassion, and just, like you said, acknowledging it as it comes up, and just, staying with it and being with it. It really invites us to step into that courage and compassion is what I'm hearing. So
Yeah.
um,
And the more
I just,
yeah, the more you get used to it, the more it isn't this affront to you that you have to run away from all the time.
yeah, it's a practice of being, not of doing. The more you get used to it, the more you embody it, the more you become it, and then the less alarmed you become through the practice. I think, at least through my experience, and I think, probably
Yeah,
for most people. So,
I think that's
um,
true.
well, Dr. Ross, it has been, I have so many more questions I could ask.
Yeah, we'll do this
And,
again.
maybe we'll do another show. And
Sure.
um, I just, I'm so grateful for your willingness, your time, your connection, your experiences, your training, and everything that you brought together so that I could share you on the show, especially during this time. It is so needed. I am so grateful. And for the listeners, I will be sharing all of your links. I have your YouTube, your Facebook, your book that's coming out, and even on here you have your hypnosis meditation. So I'm super grateful to share those with the people that are listening. And I just want to thank you. Is there anything else that you want to share? Any upcoming events or anything that you want to
Well,
share with
yeah, I mean
listeners?
everything's kind of on the down low right now because of this whole thing. But basically, yeah, if you go to my website and you go to hypno meditation, there is a really great meditation there to boost your immune system. It's free. I made it free to everybody. It's 19 minutes long. It will relax you. It will boost your immune system, and it'll give you something, positive you can do in this age where no one really knows, how this is going to go. So
Hmm.
yeah, it's free. It's like I'm trying. This is my kind of doctor humanitarian side. I'm not trying to make a profit out of this. I really want people to get access to this and share it with as many people as you can, because I know that it's going to help people. I really
Hmm.
know that it's going to help people, and I just wanted to get it out there to as many people as I possibly can.
Yeah, so I'm absolutely going to share that in my Facebook group, in my newsletter, in the show notes, because I thank you for that offering. I just want to ask one more question. I know it's a loaded question, but I
Sure,
know that clarity can come through.
sure.
What do you think, or what do you feel, or what is your insight on this COVID experience? Like, what is just in the bigger picture? Like, everybody has their own kind of belief or perception of what's happening, but why do you think we're in this place where we are right now?
Well, clearly we had lost touch with our bodies, right?
Yeah.
So this virus is showing us you got to pay attention to your body, because it's where life is. It's where feeling is.
Mm.
We're getting too caught up with our minds. We're getting too caught up with how to make them. Like on Facebook, it's like if I every day I see 15, 20 ads on how to be, how to make 6 figures or 8 figures or 14 figures. This is how I did it. This is not where life is.
Mm.
Money is part of life for sure, and we need it, and it definitely makes life better. But I think we were going down a road where we completely got wrapped up in thinking that money was going to be the salvation of all of our problems. And
Mm.
clearly, we're being shown that that's not the case. Our problems are being solved in connection, mostly with ourselves, because your relationship to other people can be no better than the relationship you have with yourself.
Mm.
And we're just being shown how to go inside. And this is our opportunity to kind of go, hey, you know what? Is it really important that, we have a private jet and we have, 15 Rolls Royces or whatever? It's really important to connect with other people, and to connect with other people in a way that isn't always financial. Like I noticed that I really get upset with a lot of these places that are trying to sell you something that will make you feel better. And the only thing that really makes
Mm.
you feel better is your connection with yourself. And,
Yeah.
you know, and that's really what I'm trying to get across to people. And I think that's what this COVID
Mm.
thing is. It's trying to get us back into our bodies, so that we
Yeah.
can actually really help each other on a different level, because the route we were going was not sustainable. And clearly this virus is showing us that.
Yeah. And seeking everything outside of ourselves. And that is just perfectly is in alignment with what the embodied healing self is all about. It's like, without this body, we are not having this experience. We're not
Yeah.
having this human experience or any part of it. It is the vessel. It is the container that holds all of the imprints, the energy, the trauma, the love, the connection, all of it. But it's all that's what the body does. It holds the experience. Otherwise, we're just a spirit and we don't feel and we don't have the same experience if we're not in the human body. So I love that you said that. And you know, what's so clear is that the virus, it, like you said, like it doesn't discriminate against in any way. It doesn't matter if you're rich or poor, or, you know, you live in Italy or the United States or whatever. It really, truly, you know, other than having a healthier immune system, really on a global scale, doesn't really discriminate. So it's humbling for us. I believe we're going through a planetary global healing. I don't want to say crisis, because I think that it's, you know, it's an opportunity, and it's a healing opportunity for all of us. And your work
Yeah,
is an important part of it.
that's the way you look at it. And you know, with your embodied healing stuff, like I have one little quick story about that, because I used to assist on neurosurgery, and you can cut right into a human brain and the person won't feel a thing. All you have to do brain surgery is anesthetize the scalp and anesthetize the skull, and you can take a flap of that and you can see a living brain. You can cut right into that living brain and it doesn't feel anything. So if you were just a brain, and you, for some reason, we could, you know, put blood and nutrients in, and you were just a brain, would you feel anything?
No.
No, you wouldn't. No, you wouldn't. So it's your body that allows you to feel. It's not your brain. The brain's the reducer. The brain is what gives us the perception of that.
I
But
love it.
really, it's
Did
our
you just call
body.
the brain the reducer?
It is, yeah, it's a reducing machine. If you
Yeah.
look at, well, if you've ever done any kind of psychedelic, you will see how well that brain actually takes in all the stimuli that's in the environment, and reduces it into an organized
Yeah.
format that you can look at. Because when you're on like LSD or ayahuasca or psilocybin, your brain's fractured. You see colors, you see energies, you see waves going by that you would never ever see in your conscious state. And I believe
Mm-hmm.
that those energies exist, but our brain reduces them down to something that we can clearly understand. And my father, getting back to my dad, I think with his psychosis, he could see a lot of these
Yeah.
energies that we couldn't, because
Yeah.
he had kind of lost the reducing function of the brain. And that's what the brain does. So it reduces your experience. And that's why you need to
Yeah.
get into the body, because that's what allows your brain to really expand into its own level of perception. Because if you don't
Yeah.
have a body, you don't feel anything.
Yeah. I love that. I love that visualization of the reducer. As a former engineer, you know, I
Yeah.
just got the clear visualization, and I agree with you on the whole psychosis part of like how much we're taking in and not having the ability to reduce, or sort of, you know, have that healthy boundary with distortion or whatever. I think there's something there, and that's a whole nother conversation. So
Oh yeah. No,
um,
we'll talk again, Jen.
yeah, thank you so much, Dr.
You're
Russ, for your
welcome.
time.
Yeah,
I'm
you're
excited
welcome.
to share how people can get in touch with you, and sending you lots of love during this time. Thank you for your service to all the people that you're able to hold in the space of just showing them, you know, how to process through their alarm, their anxiety in their body. And thank you for the work that you and your wife do.
And the same to you, Jen. Like, thanks for bringing this to people. Like, I'm not the greatest at you know, publicizing myself and stuff like that. So I
Mm,
depend on people like you to help me get my message out. You know, so thank you. Thank you for doing the work that you do.
my pleasure. I'm receiving that, and you're welcome. Have a wonderful day. Thanks again. Thank you to the listeners. Have a great day. Aloha.